Welcome, Texas optometrists, to Professional Responsibility 2026. My name is Dr. Kyle Sandberg. I am an associate professor here at the Rosenberg School of Optometry, as well as the assistant dean for professional advancement. This course is the one that's going to satisfy your requirement each year for professional responsibility or ethics in Texas. And so, without further ado, let's go ahead and get started. Here are some disclosures for you. This won't have any issue throughout this course. Here's what we're going to talk about. This is dictated to me by the Texas Optometry Board, and so each year they tell us the topics that we need to cover. So this year we're looking at updates on the Texas Optometry Board's website. If you haven't been there since 2025, you'll notice there's some significant changes and updates as far as the design goes, so we'll look at some of those. We'll talk about initial patient visits, some definitions, we'll go through some examples and when patients are considered initial, especially as it pertains to the Texas Optometry Board rules. We'll talk about some scams that have been affecting not only optometry, but throughout medicine across the board, and how people are trying to get some money out of medical providers. We'll give you some examples of those. We'll talk about compliance issues, recent violations of the Texas Optometry Board rules, as well as FTC compliance with prescription release when it comes to glasses and contacts. And then we'll end the course with poison control review, some consumer information displays, and finally with the Professional Responsibility Network. So let's go ahead and get started by looking at the Texas Optometry Board's website. If you haven't been, as I said, it's been redesigned. And so the primary thing that we want to look at in the board's website is the For Optometrists tab, and you'll see that right there in the middle. So a number of useful links for Texas optometrists. The first one we want to look at here is continuing education. So some updates since September of 2025. The first is that we replaced the requirement for the opioid course with 1 DT hour. And so it is no longer required by the Texas Optometry Board that we take this opioid course, but you do have to replace it with any other treatment, diagnosis and treatment hour in order to fulfill our total requirements. So keep in mind 32 total hours are required per biennial cycle. 1 hour each year needs to be this course, Professional Responsibility, and that is specific to each year because we have new topics to discuss in each calendar year. And then we also have 1 hour of human trafficking per cycle. So that's 1 per 2-year cycle. And the same with CPS, or basic life support, CPR rather, and basic life support. So those are a minimum of 1 hour for CPR and BLS. Now you can take more than that, and you'll see some actual details on that if you go to the board's website. And so you'll see what it says here: up to 2 hours of general CE may be awarded for a CPR course per renewal cycle, and up to 4 hours for a BLS course. That means that you can earn a maximum of that amount, but again, the floor is a single hour per biennial renewal cycle. Importantly, the certification in CPR includes, from the board rule, training and successful course completion in cardiopulmonary resuscitation, AED, and obstructed airway procedures for all age groups according to nationally recognized standards. So it does not say that this has to be taken by a specific group. It doesn't say it has to be administered to any certain level. It just needs to meet nationally recognized standards. And so there are a number of nationally recognized groups that will do that. The American Heart Association, the American Red Cross all provide CPR courses. Maybe your local fire department, EMS, provide CPR courses. It just has to meet nationally recognized standards. And then, of course, you're going to have to upload that certificate of completion to CE Broker when you're reporting your requirements for license renewal when it comes your time. Another note, though, on controlled substances, I mentioned that they removed the opioid course requirement. Excuse me. However, if you are a new licensee to the state of Texas, there's a state law, and it's right there, Texas Health and Safety Code, section 481.07635, that says that any new healthcare provider is required to take 2 hours of CE related to prescribing and monitoring controlled substances. This is not a board law per se, or a board rule per se. It is a state law. However, the board does have a rule that supports this law, and it says that the Texas Optometry Board has a requirement that you must have met this state requirement prior to receiving a license. So in a roundabout way, it is a board rule, but it's really the state law that's requiring this. This is a one-time requirement. So, and it was supposed to be done, if I'm not mistaken, in September of 2021 was the time that this was supposed to be done. So most current practitioners should have done this by now, because the board is not going to issue licenses without having taken this course. And again, just a single 2-hour course, one-time requirement, and then you are done for good. No continued requirement for opioid prescribing courses in the state of Texas for optometrists any longer as of September 2025. What else can we find on this website? If you go over here to for applicants, you'll see some required continuing education for applicants. And so as it relates to that 2-hour course, this is a great spot to find some courses. There are 4 paid options and 1 free option. They're listed right here on the board's website. So if you're like, where do I take this course? Here it is right there. And you can see it under controlled substances right here. And that'll take you to a link that will allow you to take those courses, get a little certificate, and provide it to the board for your initial licensure. Let's talk briefly about things that you need to do if these things change for you personally. You are required to update the board not later than the 10th day after the date of change of information for a number of things. Those include your mailing address. So this is where you prefer that the board contacts you. The address of your residence. This might be the same as number 1, but this is where you live. You may not want the board to contact you here, but many times it might be the same address. Any location that you provide eye care to Texans also needs to be listed and delivered to the board. And if you practice in any physical addresses that differ from your mailing addresses, you need to provide those as well. And again, you have 10 days to do that if any of those things change. Sometimes there might be some overlap with those. That's all they're looking for there. Here's where you'd update that contact information right here. Very easy under For Optometrists. Just go to that main homepage under the For Optometrists and then update contact information. Let's talk about required exam elements and quote unquote new patients. So first we need to review Chapter 279 here and the Texas Optometry Board rules. So your job in a new exam of a patient for whom ophthalmic lenses are prescribed is to personally make and record, if possible, the following findings. So A is biomicroscopy examination using a binocular microscope. B is internal ophthalmoscopic examination using an ophthalmoscope or biomicroscope with a fundus condensing lens. Importantly, videos and photographs are not allowed to be substituted here. You have to look in the patient's eyes with your eyes. Doesn't mean you can't use video and photographs to support what you're doing. Doesn't mean there's no place for those. It just means that if it's a new patient or the initial exam of a patient and you're dispensing an ophthalmic lens prescription, you need to actually look inside the patient's eyes in some way, shape, or form with your own eyes. And then finally, the subjective findings, which are the far and the near point. So your manifest refraction, showing both the far point and the near point. You need to personally notate in the patient's records a reason why it's not possible to make and record any findings that are in this section. And again, initial examination, we're going to talk about that for whom ophthalmic lenses are prescribed, if possible. So that if possible means in all scenarios where you could do it, you should do it. Now there are certainly some conditions that might make it difficult for you to get some of this information or gather some of this information. So some examples of that might be the patient just flat out says, no, you can't do that. I don't want to do that. I'm not allowing you to shine lights in my eyes or look at me. Again, document. Another example might be significant nystagmus that's preventing the patient from, perhaps getting an IOP measurement. If a child won't cooperate for direct ophthalmoscopy or BIL, hypermature cataracts, a monocular patient obviously is not going to be able to do binocular testing. Now, the three elements that I just listed in the previous slide are the things that you have to do, but keep in mind there are other elements to the exam, and I'm going to show you what those are in a second. So when we're talking about accommodative testing or binocular testing or taking the IOP of the patient, those are all required elements of the exam, and I'll give you that exact list here in the next slide. Importantly, the intent here is not that the patient and the doctor just are not in the same room. That's never really the intent of the law. And so when it comes to teleoptometry, we're not allowed to just subvert this requirement because the doctor and the patient aren't in the same place. So how can you look inside the patient's eyes with your own eyes if you don't happen to be in the same physical location? Well, it certainly will be challenging. Another important distinction is you can't just say, well, I didn't have the equipment. As an optometrist, you're required to have the appropriate equipment to meet this law and this board rule. And again, if something is not possible, make sure to document why in the patient's record. So here's the summary. And we see the Optometry Act has certain things that are required. And so this is statute, right? But then the board law supports that. You'll see probably the most extensive one is Board Rule 277.7, where we have all these elements here that must be done. And importantly, some of these have to be done by the optometrist, those being the slit lamp exam, the fundus exam, and the refraction. The others you can delegate to a technician or somebody else as long as you have it recorded. And if there's any difficulty in getting those recordings, again, please document why you were unable to get them. So let's look at a case here. So Luke Atcha, OD, saw Mrs. Ima Blur at Focus Pocus Optometry in April of 2024. Dr. Atcha was an associate doctor at that time, and then in November of 2025, Dr. Atcha opens a cold start practice called Hazy Days Optometry, about 4 miles from this original location. January 21st, 2026, Mrs. Blur walks into Hazy Days and requests an updated spectacle prescription. Dr. Atcha already has previous records from Focus Pocus in hand and dispenses a spectacle prescription at the conclusion of the exam. However, Dr. Atcha decides not to dilate the patient or perform a fundus exam, but he does take an Optos photo of the retina. So the question here is, did Dr. Atcha violate any laws or TOB rules? In this case, the answer is no. So we have to define what is an initial visit. For the purpose of compliance with Board Rule 279.3, a patient is considered new or initial when 3 or more years have elapsed since the last visit. So a 2025 board rule adds some clarity. This took effect mid-December of 2025, so relatively recently. The patient encounter is not considered initial if either the doctor or the practice maintain the records over that 3-year period. So you can have either one remain constant. In the case that we just looked at, it was the doctor that remained constant. And again, the doctor has the records, but even though the practice location changed, the doctor remained constant. Now, this only applies to examinations that result in the dispensing of an ophthalmic prescription. So let's say in the interim, the patient comes back and has some sort of a red eye, and for whatever reason, you decide to do all of the exam elements that are required under 279.3. If you do not dispense a spectacle prescription for this red eye visit, maybe it's a uveitis visit and you're doing a complete exam and taking a look in the back of the eye, that does not reset the clock. It's the last time we did all of these elements plus dispense an ophthalmic prescription. Otherwise, you have to make sure that you do them each time if it's outside of that 3-year period, because the patient then becomes a new or initial visit. Now, another example would be if Miss Ima Blur in that previous example comes back to the same original practice. So that would have been that Focus Pocus Optometry. And we saw her in that same time frame. So in this case, the doctor might be different, but the practice is the same and the records are there. So as long as the records are maintained in that 3-year period, we can see all of the elements of the exam have been met, and we're dispensing an ophthalmic prescription from that first visit, The clock starts then, and inside that 3-year period, you do not have to repeat those exam elements. So as mentioned, let's talk about some scams. Scammers are targeting doctors across all health professions through phone calls and mail, although we are seeing some communications through text, through social media, potentially through email. Many of these scammers are impersonating federal agents or local law enforcement and saying, hey, there's some sort of action against your license. Do X, Y, or Z, which usually involves giving that person money or gift cards or something along those lines in order to avoid disciplinary action against the license. They may also just be trying to get control of your personal information, and so it's worthwhile to look at what some of those look like. So this is from June of last year. This is a press release from the DEA, and CMS has released similar things, saying that they never ask for money or gift cards. In fact, it's illegal for federal law enforcement officers to demand cash or gift cards from any member of the public. It says in this letter here that the government agencies will notify individuals of legitimate investigations either in person or by official letter. So this is happening daily. This is from early 2026. This is right off social media. Just got a phone call from the Texas Optometry Board telling me that my license number had been tied to some illegal activities. An investigator assigned to my case is on the line waiting to talk to me. I didn't have the patience to get scammed. Is this for real, or do I need to call the board? I would think they would send out a letter instead. That's all I got from the thick accent. And so I didn't include the comments here, but nearly everybody's saying this is a scam, this is a scam. And it certainly is. Now, nothing wrong with calling the board and asking them. So if you reach out to the board directly, at least you know who you're calling. The board's contact information is available on the website. But if you're getting sort of any feeling that this might not be legitimate, I would caution you to be careful in responding to these people. So we mentioned already that maybe they're going to reach out by mail or by official letter. And so some scammers are actually doing that. Here's an example from the Texas Optometry Board. It's a letter that they collected from a licensee. And you see here a number of different things in this letter. Now, there are going to be signs here that this is not legitimate, but you appreciate at least that it is on the Texas Optometry Board's letterhead. All the contact information looks pretty legit. The license number and MPI and those things, as far as the address, were all correct. But of course, that's publicly available information. Some of the things that don't really make sense is this letter is referencing the Aviation Drug Trafficking Control Act of 1984. So this is an act that requires the administrator of the Federal Aviation Administration to revoke the airman certificate of a person who's been convicted of violations other than simple possession of controlled substances pertaining to state or federal law. That seems a little strange, especially if you're not a pilot. Let's say this person was a pilot and you're like, okay, maybe something's going on. What else in this letter might give us some pause? Here, this is referring to U.S. code or federal code, 21 U.S.C. section 804. It's referring to a section of the Federal Food, Drug, and Cosmetic Act that allows states, Indian tribes, or certain entities to import prescription drugs from Canada to lower costs, provided they meet strict FDA safety, quality, and testing requirements to ensure they're the same as the U.S. approved versions. Little fishy. And then at the bottom here, if you'll appreciate this part, 18 U.S.C. section 3142C, this pertains to federal pretrial release conditions, which are bail rules, has absolutely nothing to do with license restoration. You'll see some other things that are a little off. What is writing the Texas Optometry Board licensure? Receive is spelled wrong. Aviation spelled wrong. And so those are things that should hopefully tip you off. And again, if you're feeling suspicious, just contact the board. They may actually reach out to you by mail. So this is a legitimate way that they might communicate with you. And one of the important reasons that we update our addresses and keep them abreast of if we're changing locations or addresses because they may need to reach out to you by mail. However, looking through the letter, we see a number of red flags, and you can always call the board and be like, hey, I've received this letter, before you respond to anything that is outlined here in this letter. All right, let's jump into something else. What's wrong with this picture? Crisp and clear optometry, Dr. Wanda Sia, OD. And we see a nice little storefront, little optical there. And the answer, of course, if you've taken this course at all in the past, is our professional designation is off. So we have a list of professional designations that come from the Texas Occupations Code. This is true for all medical professions in Texas. It's true for MDs, DOs, nurses, dentists, chiropractors, you name it. The proper designation must be included on any of these. So the door of the practice, business cards, prescription pads, phone book, electronic listing, stationery billing invoices. Basically, anytime your name is written down, it needs to be the proper designation. And so what are those designations? Let's review them once again here. Of course, these are on the board website. You can find them under the board rules. You can also find them in that section that I referenced. But QC Better OD or QC Better Doctor of Optometry, QC Better Optometrist, or Dr. QC Better Optometrist. And you'll notice what we did in that example where it was incorrect is this bottom one just said OD afterwards. So Doctor plus OD, and that's probably in my guess the most common one that gets people in trouble, or using nothing at all, just saying doctor. A therapeutic optometrist must use one of the following: read or read well therapeutic optometrist, or doctor read or read well therapeutic optometrist. So again, we're spelling all that out. Optometric glaucoma specialists can use that as a professional designation, but you have to use it underneath one of these previous titles. So right up here, one of these titles in the top part of this slide, you can add optometric glaucoma specialist. So I'll be seeing OD, Norma Site, therapeutic optometrist, optometric glaucoma specialist. Keep in mind also from last year's course that all new licensees are licensed as optometric glaucoma specialists unless there's some sort of problem with the previous education. So in other words, if you graduated before May 2008, you do need to show that you have met the criteria for an optometric glaucoma specialist. But the idea being that all new optometrists in Texas are going to be licensed, for the most part, to the highest level that we are allowed to practice. Here's some other important rules as far as deadlines and things like that, and which rule is required there. So if the TOB requests things like patient records, written complaint and responses, or maintenance of or showing that you've maintained accurate patient records, you can see that most of those are going to have a 14-day requirement, and you see the possible penalty here as well. The authority of the board, here's types of sanctions, here's our source here, and then here are some notes on that as far as what they can do. So it's important to understand that the Texas Optometry Board certainly has authority over the practice of optometry in Texas. They can either issue fines, or they can issue reprimands, or they can just take your license away. So it's important that when the board reaches out, we first want to make sure it's legit and not a scam. And once you've verified that, then make sure you're responding within an appropriate amount of time. So that moves us into a really interesting topic. I mentioned we're going to talk about the National Practitioner Data Bank. So I'm going to tell you a story, and this is all public information. It's been in the news in a number of different places, and so I'm just going to use this guy's name. It's right out of an article from MedPage Today, but you'll find it across many different sites. So this is a doctor named Larry Mitchell Isaacs. He surrendered his medical license after he allegedly removed a healthy kidney during what was supposed to be a colon surgery. So it sounds like a pretty egregious mistake. So what did he do? He moved to California and this is in Louisiana initially. So he moves from Louisiana to California, gets a new medical license. In California then, he mistakenly removed a woman's fallopian tube during what was supposed to be an appendectomy. Very interestingly, the patient had previously had her appendix removed, so I guess he got in there and decided I can't find the appendix, or maybe I think this is the appendix, and decides to take out a fallopian tube instead. He surrenders his California license and he moves to New York. Gets a license in New York. However, as he's starting to get his license in New York, the medical board in New York is starting to question his sort of storied past here and says, we're not gonna, or we're gonna pull back on your medical license. Maybe we'll give you sort of a probationary license. So he's like, this isn't working for me. He surrenders that, and then he moves to Ohio. He still practices there to this day. So this feels like somebody subverting a system where they're getting in trouble and then just moving to another state and continuing to practice there. And there are hundreds of cases of this happening. Obviously, across the board, it's a very small percentage of doctors, but it is a possibility that somebody could have a license revoked and then practice in another state. So, and I wanted to verify this. So I went to, if you see up here at the top, we're at elicense.ohio.gov. Sure enough, here he is, and his license expiration date is October 1st of this year. He even has a little rating over here on WebMD pages. Smart doctor with poor communication skills and a checkered past. I felt spoken down to, and I learned after my appointment several states revoked his license. I'll never go back. So at least maybe some people are aware of him. What is the way to combat this? Because by law, state boards can do whatever they want. They can license under whatever authority they have, and they don't have to meet a specific checklist or anything like that in order to license a practitioner. So the answer is, and this was enacted in 1986, so obviously in the previous case, it's not being used, and some states don't have a requirement that you have to access the National Practitioner Data Bank. The goal here of this data bank is to protect the public by reducing healthcare fraud and abuse. So one of the major goals is to prevent what I just showed you has happened in the past. Now, there's some other goals, and I'll talk about those in a second, but it is a way that state boards of medicine, of optometry, of dentistry, of whatever health profession are able to reference if there have been complaints or problems with a licensee in the past as they're getting their license. So the Texas Optometry Board respects this and actually requires all new licensees to submit a self-query and then send that report to the Texas Optometry Board. This is incidentally listed as one of the main reasons that licenses get delayed. So what do they collect? They collect medical malpractice payments or information about that, adverse clinical privileges, actions per state licensing agency, loss of license. So some of these, of course, would have come up in that last case that we were talking about. Adverse professional society membership issues, any adverse actions reported from the DEA, and exclusions from any federal or state healthcare programs. So a lot of those things would have popped up, of course, for this individual doctor that we just referenced. So who has access? As I mentioned, you do. You can see if your name is mentioned in there. Legal representatives, hospitals and healthcare entities, professional societies. The TOB belongs in this second from the bottom, licensing or certification authorities, and researchers and the public. Now, the public or researchers don't have access to all the personal information. So that's important, but they can still see if there is action taken against an individual. So some interesting facts here. Potential actions against a provider are not reported until the adverse action has been in effect more than 30 days. Rapid resolutions, therefore, are advised. In the case of a malpractice claim, if the practitioner makes a settlement with the aggrieved individual before an actual claim is filed, the action does not get reported. So again, making these, wrapping these up as quickly as possible if you find yourself in this situation. If it's against a group or a corporation, if the individual within the group is dismissed from the case, then that individual will not be reported in the NPDB. And then claims settled with an aggrieved individual are not reportable if the provider uses their own money to settle the individual claim. What happens if your name ends up in here? You're like, oh no. So what's going to happen is the MPDB is going to send a copy of that report to the provider and say, hey, somebody made a report against you. Well, that's a patient, an insurance company, a state board, whatever it might be, and you have 60 days to file a dispute. The next step in that dispute is that you can submit a 4,000 word or less challenge that remains then attached to the report. It's strongly advised that you engage legal counsel in this matter, and then these reports are finally engrossed by the MPDB, and they remain in effect forever. So again, trying to get a pretty get in front of this as fast as you can is going to behoove you if you end up in this situation. So what might the TOB report? Adverse actions of a single nature, egregious disregard for the law or repeat violations, significant deviations from minimum competency rules. So again, not just being a step or two or missing an element or two. And then any actions involving criminal activity. What they won't report is minor administrative actions, things where they're asking you to pay a small admin fine. But significant means significant, and it's determined by the Texas Optometry Board on a case-by-case basis. So it's really up to them to determine what would significant be, and then they'll report there. And again, it works the other way around, especially with a new license, that they are requiring you to access this data bank to show that you do not have any reports against you. FTC rules. Let's talk about these. The eyeglass rule from June of 2024. So this augmented or updated an earlier rule from the early 2000s that requires some certain things from a prescriber. So in 2024, we changed the requirement that prescribers, after providing the prescription, request that patients sign a confirmation letter showing that they received their prescription, and then you have to keep that for 3 years. So these rules only apply to people that are selling glasses, optometrists and ophthalmologists who have a financial interest in providing that prescription eyewear. So also, it allows prescribers to provide the patient with a digital copy. Again, from the updated earlier rule in the early 2000s, the 2024 rule updated to say a digital prescription is allowed in lieu of paper copy. However, if the patient says, no, this is not for me, I want a paper copy, you're required to give them a paper copy. Explicitly specifies that the prescription must be provided immediately after the examination is complete. A patient must have their prescription before any offer to sell them glasses. And it clarifies that presenting proof of insurance is deemed to be an acceptable method of payment. So as long as they present valid insurance, that means that they have paid. It also helpfully changed the term eye examination to refractive eye examination, so that it's very clear that a refractive eye examination might not include all of the health elements, right, that are required. Again, this is a national rule. We know that the state of Texas has some other exam elements in place by rule. So this is just talking about from the FTC. This is a national rule that is meant to protect patients. So there are some times when you're allowed to hold a prescription. There's not many, but there are a few. One is if the patient has not paid for the examination, keeping in mind that insurance, proof of insurance counts as payment, but you have to have requirement for immediate payment in all cases, even those that require no purchase or that don't result in the requirement for ophthalmic goods. So best to just say across the board, if this is one thing that you want to use to perhaps withhold a prescription, it's best that for all your patients, regardless of a prescription issuance, that you have a policy that says when the exam's over, you have to pay. And then the second part of that, if there is a reason, medical reason, for a follow-up necessity. So when the exam is over, and you see that in the first FTC rules back here, at the conclusion of the examination, provide immediately after the examination is completed. So you can say when the exam is actually over, right? And especially for something like a contact lens fitting, where you maybe want to see that patient back after they've worn the lenses for a little while, the exam is not over yet. And so if there's any additional need for information from a medical standpoint, you have the authority to say the exam is not over, and therefore you do not have to release the prescription. All of those things here apply to this second part of the rule. So the term fitting is accepted to include an examination of the term lens specifications, except in the case of a renewal of a contact lens prescription and initial evaluation of the fit on the eye, and then medically necessary follow-up examination. So that's pretty wide. You can use that whichever way you want, especially if you feel like it's medically indicated for the patient to come back. So what about the signature thing on the contact lens prescription? We talked about this a little bit last year, but let's review it again here. Here's the language in the statute. So confirmation of prescription release. Upon the completion of a contact lens fitting, and this is specific to contact lenses, not spectacles, the prescriber shall do one of the following. Request the patient acknowledge receipt of the contact lens prescription by signing a statement confirming. Request the patient sign a prescriber retain copy of a contact lens prescription that contains a statement confirming the receipt of that, or request that the patient sign a prescriber retained copy of the receipt for the examination that contains a statement confirming the receipt of the contact lens prescription. If you send them a digital copy, you need to make sure that you keep that. So also the digital copy should be sent by some sort of secure portal or secure email, or if the patient signs a waiver that says, I'm okay just sending it to my personal email, non-encrypted, then you want to hang on to that as well. Those are the reasons or the ways that you can get that signature. And I think I'll make it a little bit more simple here on the next slide. You can use this statement. It says, it's right here, my eye care professional provided me with a copy of my contact lens prescription at the completion of my contact lens fitting, but you're not required to. There's no statute that says you have to use that, but that statement is actually in the statute, so it could be a good phrase or something to put on one of these things that the patient is signing. And then if the patient says, I'm not signing that, then you just have to document it. So here's kind of in plain English. If you're doing it on paper, have them sign a statement that they received it. Again, you can use that statement from the last slide. Make a copy of the contact lens prescription and have them sign that. Or have the patient sign a payment receipt for the exam showing that it was released. If you're doing it electronically, save a record that it was sent for 3 years. All these things are for 3 years. And finally, if the patient is saying, like, I'm not signing that, you can't make me sign anything, that's fine. You cannot make them sign anything. Just make it sure you note it in the chart, and then you sign the chart. Make sure you note the patient's refusal. All right, getting kind of close to the end in the last 5-10 minutes here. Next thing I want to talk about is poison control. So the Texas Poison Center Network. And if you see these, this is really interesting, actually. So depending on where you are, you've got these regions for poison control. And you see that they're sort of centered around these large cities, but see all the counties that each one of these poison control centers are responsible for taking calls for. The Texas Poison Control Network receives nearly 250,000 calls annually. 87% of those calls are managed over the phone without the need for additional care at a hospital. About a third of those calls come directly from physicians, nurses, EMS providers, pharmacists, and physicians' assistants. The helplines that they use are staffed by specially trained physicians, nurses, and pharmacists. The goal of the Poison Control Network is to save lives and protect the health of Texans through direct medical services, data collection, and monitoring. The annual cost savings of the Texas Poison Center Network is $85.5 million a year is an estimate. So it's a hotline that you can call. Here it is. Any patients that seem to be experiencing adverse drug interactions, or you think maybe overdose, alcohol poisoning is part of this, and you can reach out at this number here, 800-222-1222, and they're accessible by anybody in Texas. So it's important that we recognize that that's an available resource, and the board wants to make sure that you have that resource available for your patients, staff, family, and yourself. Let's talk about required signage as one more element here that we want to review by mandate of the board. So the Texas Administrative Code, this is a board rule in 273.9 that says that basically the public needs to know how to complain about you. And so you need to have that information posted somewhere where the public can see it. There are a couple ways that you can do this, and it has the board's contact information about it. One is this consumer information notice. You'll notice that it is in both English and Spanish. The office moved to this address. So if you have an old sign like this and you're like, oh yeah, I'm definitely in compliance, the new location is required to be on your signage. So make sure you're not using the old one, and make sure it looks like this. You're printing both English and Spanish. When you print it out, it comes like this, but make sure you're posting in both languages. The other option is to do the consumer information brochure. So this is a brochure that's available on the board's website. You can see it was updated last in March 2024. This has a bit more extensive information about it, but this is a way to show the public how to file a complaint. Interestingly, you'll see that some of these things are, so this entire pamphlet is not in Spanish, but you'll see down here on the bottom that this pamphlet is available in Spanish language upon request. So that's also accessible on the board's website. So you may want to have some of these printed out. You just have to do one of these. It could either be this sign or it can be the brochure. It's totally up to you, but they have to be accessible to the public. If you want to print out this brochure, it shows you where to fold it. It's a little tri-fold brochure that you want to fold on the line here. You see it differentiates optometrists, ophthalmologists, and opticians. Where would you find this? Well, go to the Texas Optometry Board's website. Go to For Optometrists here. Again, right in the middle. And then you'll see the practice guidelines FAQ, and you will see a consumer information notice or the consumer brochure. Both of those are available. And finally, as we do each year, we talk about the Professional Recovery Network. This is a network that was enacted in 1981 by the Texas Pharmacy Association, and optometry was added now coming up on 16 years ago, September 1st, 2010. It helps professional students and professional staff in the fields of pharmacy, optometry, dentistry, and veterinary medicine to overcome potential impairment due to substance abuse issues or mental health issues. Before this was enacted, really there was no other avenue besides taking away a professional's license or taking some action against the license, disciplinary action, if a patient or if a person had mental health or substance abuse issues. Reporting and treatment are confidential. The goal here is to provide public safety while preventing disciplinary action against a professional license. These apply if the individual complies with their treatment program. The contact information is here, and they typically hold seminars in Austin on an annual or sometimes biannual basis. Check their website there at txprn.com if you're interested. And of course, there's all their contact information. I always like to wrap these courses by saying that I am not an attorney. I have just been tasked with reviewing some of these laws in conjunction with the very helpful people over the Texas Optometry Board. So thank you very much to Janice McCoy and Dr. Ron Hopping for taking the time to review these slides and the information and making sure that what we have presented here is accurate. I am available here by this email address, ksanburr without the G at uiwtx.edu should you have any questions. If you are taking this course online, which you most likely are, there is a requirement that you also complete a quiz that is associated with it. So this will be on the Rosenberg School of Optometry's continuing education website. If you're accessing this course, for example, on YouTube, We will have the link directly to this course on our website, but please make sure that you do two things following at the conclusion of this course. One is that you take the quiz and you submit all of your letter answers. It's a 10-question quiz. And the second thing is that you make your payment. So once both those things have been received by the school, we will automatically post credit for you, typically every 2 weeks. So please be patient with us. We are a single person, 1.5 person department on a good day. And it takes some time to review these. We grade them manually. And so we just want to make sure that you're correct. If you happen to miss any of the questions on the quiz, we will give you a second opportunity to retake the quiz and try again to get the information correct without charging you again. So it's not the end of the world if you don't get the required 70%. But if you do get the 70% on the first try, please give us a couple weeks to post that credit to your CE broker account. And once you see it reflected there, you will be good for 2026. Hopefully you're not taking this at the very end of the year. We do get a little bit backed up, but if you feel like it's taking too long, you can always reach out. But please know that we're doing our best to get those quizzes graded and posted to your CE broker accounts. Again, thank you for your time. If you have any other questions, please feel free to reach out to me or to the executive director of the Texas Optometry Board, Janice McCoy. All that information, the contact information can be found on the TOB's website. And we hope to see you again in person or sometime in the future right here online. Thanks again for your attention. Take care.